Welcome everyone to Benefits and Retirement Aspects of the newly enacted One Big Beautiful Bill Act. Thank you all for joining us. The Benefits Compliance team will be answering the questions you sent through the Q&A today. We'll try our best to answer all of your questions, but if for whatever reason we're unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded. We'll be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday you'll receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At this time, I'll turn it over to Sarah Burns, Vice President and Senior Counsel of Benefits Compliance at NFP. Sarah, the floor is yours.
Thanks, Amber, and welcome everyone to our discussion of the employee benefits aspect of the One Big Beautiful Bill Act, or the OBBBA. I'm here today with my colleagues Sharon Cohen and Molly Sled from NFP's Benefits Compliance team and Tom Baston from NFP Retirement. We're also being supported by the rest of our National Benefits Compliance team, who are standing by to answer questions in the Q&A as we go along. So please pop any questions in there and we'll try to answer questions live if time permits. I think we already got one question, which Amber just answered, but I'm going to answer it again in case anyone missed it. We will be sending a copy of the recording and the slides sometime next week to everyone who's registered. So look out for that. Before we get started, we have a quick disclaimer. So none of what we discuss today is intended to be tax or legal advice. It's for general guidance and educational purposes only. If there are any specific questions on the application of this new law, they should be directed to your legal counsel or your tax advisor. And also what we discussed today, it's based on what we know now. Even though the act was finalized several weeks ago, it was passed several weeks ago, there are several aspects where we're hoping for guidance from the federal agencies that are tasked with now interpreting the law, namely the IRS. The law is really sparse on some of these employee benefit provisions, and any new guidance that we get probably will impact our interpretation. Or it's going to answer, some of our outstanding questions. That's our hope, and we think that you guys will all have the same questions. If we do get any new notable guidance, we'll report on that in our bi-weekly NFP Compliance Corner newsletter, so please keep an eye on that. On to today's agenda. We'll be referring to the OBBBA as a tax act, because it's a bit difficult to say, and that's what it is the tax act. And given that it's summer, a popular time for travel, we decided to adopt a trip planning theme to today's agenda. So we're going to start with a very brief overview of the legislative process, just for context. We're charting the course, planning the trip, if you will, basically where the bill started and where we ended up. Next, we're going to unpack the essentials, the essential employee benefit aspects of the Tax Act, and they're listed there. We're going to address each of these by describing the current rule, the Tax Act changes, the impact on plans and takeaways, and then the effective dates of the change. For employee benefit purposes, the most notable changes that we saw were to the HSA rules, so we're going to discuss those in more detail. There are also changes to dependent care assistance programs, or DCAPs, educational assistance programs, which includes student loan repayment assistance, and then also a new child savings account vehicle called Trump accounts, which has an employer contribution option. So we'll discuss all that, and we'll touch on one notable repeal of an employee benefit that was tax-free bicycle commuting reimbursements. And then we'll move on to other employee benefit tax provisions in the bill, which we're referring to as carry-on items. And we'll end with a review of proposed employee benefit changes that were in the initial draft of the bill or earlier versions of the bill. You may have heard of them. We had reported on some of them, but they got dropped from the final version. And we want to make sure that we're clear on what's in and what's out. So charting the course, the legislative process. The first version of the bill was introduced in the House in May, and it included a number of provisions related to the HSA rules and also ICRAs. So that may be familiar if you read about that. We'll review the aspects that got dropped later on these, but know that this initial version is very different from the final version. So the House version, it passed by the slightest of margins in the House and then went to the Senate. The Senate then introduced its own version of the bill, removing some employee benefit provisions, and then adding others. This is a process called budget reconciliation. The bill then continued to be reworked with a version that was passed by the Senate on July 1st, again by one vote. And then the Senate's version went back to the House, which the House approved on July 3rd, and the bill was signed into law on July 4th. Okay, so let's get into what actually made it into the final act, which we're calling unpacking the essentials. One very notable change in employee benefits, again, an HSA rule, we got it in the 11th hour, relates to HSA eligibility and telehealth. Molly, can you walk us through that?
Absolutely. Thank you, Sarah. So, yeah, she noted this is probably the item that we're getting the most questions about right now so far since the bill was passed a few weeks ago. This has been subject to kind of a lot of back and forth over the past several years. The issue of telehealth coverage and whether or not it makes someone who is a participant in a high deductible health plan eligible to make and receive contributions to their HSA. Um, this was first there was relief that was first passed back in 2020 as part of kind of the response to the pandemic that said, yes, you can go ahead and receive your first dollar telehealth coverage without impacting your HSA eligibility, without making you ineligible to contribute to an HSA. However, that was temporary, it expired, it was reissued, it expired, etc. And the last extension did expire at the end of 2024, and it was not taken back up in kind of the more recent sort of budget talks, budget bills that were passed earlier this year. So as a result, the current rule was that first dollar or low cost telehealth coverage is indeed considered impermissible coverage. That means that it makes a high deductible health plan participant ineligible to either make or receive contributions to their HSA. That's because that telehealth coverage is providing benefits before that minimum high deductible health plan deductible has been met. Now, the change that the Tax Act implements is, again, reverting back to that relief that was passed earlier during the pandemic. Telehealth coverage can be provided to high deductible health plan participants at low or no cost. This is before meeting that statutory minimum deductible, and it will not impact their ability to make or receive HSA contributions. Right. So, as a takeaway, you know, it's important to note that this is optional for employers, for plan sponsors. It's not mandatory that you adopt this, and it's not automatic. So, the first thing you want to do is look at the plan, consider whether or not this is something that you want to implement. Do you want to have a telehealth benefit paired with a high deductible health plan that is providing low cost or zero cost coverage to participants? Consult with your carrier or TPA or your standalone telehealth vendor about implementation. The first step is going to be look at your plan documents, see if they need to be updated and amended. If so, you may need to issue a summary of material modifications explaining that amendment. Also, you'll want to look at the timing of the change. There are issues with trying to implement a change mid-year. And this goes for whether there is no telehealth benefit in place currently in your plan, and you want to go ahead and put one into effect right now, kind of right away, mid-year. Or let's say you do have a telehealth benefit, but it's currently charging fair market value so that it can kind of coexist with that high deductible health plan. But you want to go ahead and switch it to zero cost. With both of these options, implementing those changes mid-year is going to be tricky. It's going to be administratively difficult. First, you want to see if your carrier or vendor can accommodate it. And second, you want to think about the impact that it's going to have on your plan and your HR administrative load. Not least of which is making sure that summaries of benefits and coverage, SBCs, get updated and reissued in a timely manner. For that reason, we think the easiest thing to do may be to wait until renewal to go ahead and implement that low-cost telehealth plan with a high deductible health plan. All right, and also there were a number of employers, whether they decided it themselves, they weren't aware of the change, or maybe they were advised by their telehealth vendor, who went ahead and continued with first dollar telehealth coverage with their high deductible health plan, even after that relief did expire at the end of 2024. For those individuals, there's no action needed at this time. Oddly enough, this bill has cured the non-compliance for those individuals. You're now good to go. So those are kind of the takeaway items, but it's important to also think about the impact from a strategic perspective of this change. So from a strategic plan design perspective, employers can offer and integrate telehealth more broadly into their high deductible health plan offerings. That is going to enhance access for participants, right, to have that low cost or zero cost telehealth right at their fingertips, and probably increase the value of that high deductible health plan to them. It also has the potential to increase employee engagement and provide cost savings for the plan, because telehealth coverage can lead to cost savings over, traditional medicine. Also, it's just good to know that this relief is permanent. The relief is a relief, honestly. We don't have to wait for, the next bill to see if it's going to be put into effect or if it's going to expire. Now that brings us to the effective date. This goes into effect for plan years beginning on or after January 1st, 2025. Basically, it eliminates any gap that was created when the old temporary relief was expiring at the end of 2024. It does take effect retroactively and permanently. However, again, I have to emphasize this is an optional change for employers. It is not going to automatically go into place. It's not as if employees who had, telehealth that was charging fair market value now suddenly get to get their money back for all their telehealth visits that they paid for since the beginning of 2025. There are action steps that need to be taken by employers, as I discussed, to adopt it. And also, we have not come across any carriers or vendors who are able or willing to accommodate a retroactive adoption. So even though the retroactive adoption, as we said, does cure the non-compliance for those who didn't make the change, it's going to be very difficult to accommodate for those who want to change things at this point. All right. Next slide, please. All right, so continuing with the theme of changes to what is and is not HSA compatible, or really what is HSA compatible now. This next item, it does not have a huge impact on employers or plan sponsors, but again, it does impact HSA compatibility. Currently, only individuals who are enrolled in what's called a qualified high deductible health plan that meets statutory minimum deductible amounts and has a maximum out-of-pocket level, right, for single or family, changed each year. Only those individuals who also do not have any other disqualifying coverage are eligible to contribute or receive contributions to an HSA. Now, the Tax Act changed the definition of HDHPs, or really it changed what qualifies as a high deductible health plan to expand it so that plans that are categorized as bronze level and catastrophic individual plans that are offered through the marketplace can be treated as qualified high deductible health plans. Themselves, they do not need to have those minimum deductible levels or maximum out-of-pocket levels, right? A lot of times catastrophic plans have extremely high out-of-pocket levels that definitely will not qualify under those IRS rules. But as a result, those bronze and catastrophic individual plans offered through the marketplace will be HSA eligible. So the takeaway here for us is that employers might be allowed to contribute to the HSAs of employees enrolled in those bronze or catastrophic marketplace individual plans. This may be of particular interest, we think, to employers who sponsor ICRAs, right? Those individual coverage HRAs, where the whole point is that the employer is giving money to the employees to then go buy their own individual coverage. If they happen to buy a regular, pre-existing high deductible health plan or a bronze plan or a catastrophic plan, they will be able to make and receive contributions to their HSA. This is going to be going into effect starting January 1st, 2026. Right. So next, I'm going to let Sharon take us on the next leg of our journey, which is direct primary care service arrangements.
Thank you, Molly. So let's start out by telling a little story. In June of 2020, the IRS and Treasury issued proposed regulations that were related to Section 213, which is the code section that defines medical expenses. And these proposed regulations were prompted by an executive order that directed IRS and Treasury to improve access to affordable care by recognizing what was then called direct primary care arrangements, and also healthcare ministries. So the IRS defined in those proposed regulations a DPCA as a contract between an individual and one or more primary care physician to provide medical care for a fixed annual or periodic fee without billing a third party. And those proposed rules said that this sort of fee, this DPCA fee, might qualify as medical expenses, or they might be considered medical insurance. It just depended on the arrangement. But in the guidance, the IRS held that individuals who were enrolled in a DPCA were generally ineligible to contribute to an HSA unless the fee was solely for preventive care or some other permitted coverage. Now we have this Tax Act, and the Tax Act implements a new statutory category, which is a direct primary care service agreement, DPCSA. And this was a legislative response to the limitations and the ambiguity in the 2020 proposed regs. So the goal of this provision is to expand access to direct primary care while preserving HSA eligibility. Again, it's focused on HSA eligibility and permissible reimbursements under an HSA. So a DPCSA is an arrangement where an individual pays a periodic fee for primary care services only delivered by a licensed practitioner. The law excludes services that go beyond routine outpatient care. The definition is intentionally narrow to ensure that the focus is on core primary care and not specialty or hospital level type care. And the statute asks the agencies to issue guidance defining primary care. So I want to take a quick moment here to draw a distinction between concierge medicine. While both a DPCSA and concierge models involve membership fees, they do differ, and hopefully the guidance that we get from the agencies are going to help draw the distinctions even further. So first of all, a DPCSA defined in this new provision of the law in the Tax Acts, they're limited to primary care, and it's a capped monthly fee, and that fee goes towards the cost of the care that's provided. Typically, in this kind of arrangement, there's no insurance billing. For a concierge type arrangement, which can also be known as a retainer-based care, it's a model where patients pay a membership or access fee upwards of $1,500 a year to receive enhanced medical services. These can be things like extended appointment time, 24/7 access to physicians, personal care coordination like referrals and diagnostic testing, and generally they include like an annual physical. So concierge practices often bill insurance for covered services, meaning that the fee is not the sole payment for the care that's provided. And the fee is generally towards access or convenience Because of this, concierge fees are typically not considered medical expenses and not reimbursable from HSAs. The second point I want to make is that we can't always take comfort in a name. Something might be labeled or marketed or called direct primary care, but the label is not necessarily indicative of whether or not that fee will qualify as a medical expense generally, and more specifically for the purposes today under this new provision of the law for purposes of HSA eligibility and reimbursement. So what's the takeaway here? The law amends the definition of an eligible individual and qualified medical expenses for HSA purposes, but it has certain limitations. Those limitations include that the monthly fee can exceed $150 for an individual or $300 for a family, and this amount is indexed annually. So the fee that fits this definition here, and the fee is for primary care services offered on a fixed periodic basis, that sort of fee, that payment does not inhibit HSA eligibility. The individual can make contributions to an HSA, and it can be reimbursed under the HSA. We kind of call this provision employer adjacent because it doesn't directly have an impact on the employer or even the employer-sponsored HDHP. It does impact the individual. And as we all know, the employer is not responsible for policing an employee's HSA, but of course, an employer can help educate employees about HSA reimbursable expenses. In terms of salary reduction, HSA contributions, I would say the employer is responsible to the extent that they have knowledge. So in most circumstances, an employer would have no reason to know if an employee has permissible or impermissible DPCSA coverage. This provision will take effect January 1st. My thoughts is that it may be in this instance best to take lead from the HSA vendor as to what type of information they're going to provide to individuals. And of course, we do expect guidance from the agencies, and we are always on the lookout for this IRS guidance. Molly, what can you tell us about dependent care?
Yeah, so another kind of hot button topic in the Tax Act is the change that was implemented for dependent care assistance programs. These are referred to as DCAPs, also dependent care FSAs. You'll see them referred to as that. Some people call them child care accounts, expense accounts. We're going to call them DCAPs here. So currently, as you all know, DCAP is a type of FSA account where employees can put money pre-tax to spend on qualifying childcare expenses. Currently, there is an annual maximum that is set. It is $5,000 if you are single or if you're married and filing jointly, $2,500 if you are married filing separately. So the change that the Tax Act has put into place is it is increasing that annual exclusion amount. So that will now be $7,500 if you're single or married filing jointly, $3,750 if you're married filing separately. Now, just a little bit of history. The dependent care account maximum was first put into place back in 1986. And in 1986 dollars, $5,000 would be equal to just under $15,000 today, if you use the CPI inflation adjustment calculator. And $15,000 is about the national average for childcare. Of course, it depends on where you live, metropolitan areas versus rural areas, et cetera. I can tell you as the parent of 3 small children, I spend a lot more than that every year on childcare. So the original limit was not indexed for inflation. It was just set at 5,000 and kind of left there for 30 years, 40 years, 40 years. Unfortunately, the $7,500 amount, while it is a very welcome increase, it is also not indexed for inflation. So it will take another act of Congress to either change that, increase that amount, add an index for inflation, to affect it in any way in the future. Okay, so the takeaway here, again, this is optional. It's not automatic. It's not mandatory. If you have a dependent care account program or dependent care assistance program in place already, then you want to consider whether or not to adopt the higher limit. That's going to involve working with your FSA vendor to update your plan documents and update your systems, including payroll, in time. You also will want to make sure that you communicate the change clearly and often during open enrollment and leading up to open enrollment to help boost employee participation, awareness, understanding, and making sure people can see the enhanced tax savings. Now, with that being said, it's also extremely important to look at what the impact will probably be on your plan as far as non-discrimination testing goes. So, as you're probably aware, DCAPs have to pass certain non-discrimination tests. It's under Section 129 of the Internal Revenue Code. There are several, like 4 different tests they have to pass, and one of them, it's called the 55% average benefits test, is very frequently failed through no fault of the employer. It's just that it just so happens that highly compensated individuals are more likely to elect and use DCAPs, especially elect the full amount. So if you are already finding that your DCAP is failing the non-discrimination testing with $5,000, it is much more likely that it will fail at $7,500, right? And what that means if you fail the non-discrimination test is that you do have to basically make that benefit taxable to your highly compensated individuals, or you have to make an adjustment to lower the election for all of your highly compensated employees so that it can pass. So it adds another level of administrative burden, right? So before you kind of rush into wholesale adopting this higher limit, just, take a look at your plan, at who's participating, and whether or not it's going to be more likely that it will fail that non-discrimination test. Okay, so this goes into effect for tax years starting January 1st, 2026. Again, it's optional. All right. So I think we will hand it back over to Sharon to talk about education assistance.
Let's take a minute to talk about an educational assistance program, which is a tax advantage benefit that allows employers to provide up to $5,250 per calendar year in educational assistance to employees without including it in the employee's gross income. So this includes expenses like tuition, any school fees, books, but temporarily, it also included a student loan repayment option, which was set to expire in 2025. So the Tax Act put in place a couple changes. The first one was that it now indexes, similar to the dependent care, it indexes this $5,250 annual limit. It's going to be indexed for inflation annually, so it will increase over time. And it also made the student loan repayment provision permanent, so no more sunset dates. Just to remember that these programs are employer funded. They cannot be funded with salary reduction dollars, but employers can continue offering tax-free student loan repayment assistance as part of their educational benefit strategy. This may add some support for the choice account model, and it can help employers attract and retain talent. So especially younger workers managing some student debt. The changes go into effect January 1 of 26. And now I'm going to hand it off to Tom to tell us about some Trump accounts.
Thank you, Sharon. So as you can see here, a new child savings account has been enacted. The media is referring to them as the Trump accounts. So any child under the age of 18, regardless of birth year, is qualified as long as they are a U.S. citizen and have a Social Security number. The account has to be opened through a qualified financial institution that has not been defined yet. Most likely that'll be a bank or a brokerage firm, but we'll have to wait for that guidance. Contributions can be up to $5,000 a year after tax from parents, guardians, and employers. The parent and guardian contributions are not tax exempt. And the annual contribution limit will be indexed for inflation beginning in 28. Now, the interesting part of this is the pilot program in which the government will put money into the account for newborns born during one of 4 years, 25, 26, 27, and 28. So this is all that's included in the legislation. So it's entirely possible come 2029, there are no more deposits made for children born in that year or thereafter. And the government funding will not begin until July of 26, because not only do they have to first define what a qualified financial institution is, but there are several other things in the legislation that are not clear, which are going to have to be clarified. So the children born during those 4 years qualify for a $1,000 one-time deposit. They will be automatically enrolled. However, the account will have to be activated by a parent or guardian. So again, until they have an account, there's going to be no money deposited into it. The accounts will operate very similar to an IRA. They're going to grow tax-free until withdrawal. And then withdrawals will be taxed based on the ordinary income tax plus a 10% penalty if under age 59 and a half, unless one of the qualified reasons listed in the IRA rules is utilized as a distribution from the account. If you can go to the next slide. This is where it gets a little tricky because I personally felt the House version did a little bit better job of describing when the money should be used and how it could be used. So for instance, in the House version, they talked about 50% could be withdrawn starting at age 18. Now, keep in mind the way this is set up, the parent or guardian has control over the account until the child turns 18. Once they turn 18, the child now has control over the account. What the House intended was for it to be used for qualified purposes under the IRA rules. So a small business loan, college tuition, first-time home purchase, things of that nature. And they wanted to limit what could come out at 18 to 50% and then 100% at age 25. And if it was used for these qualified purposes, you wouldn't have to worry about the 10% penalty. And then at age 30, it could come out for any reason. Well, the final tax act that came from the Senate didn't include any of these withdrawal limitations. So it's really unclear. I mean, the way it reads right now, an 18-year-old has total access to the money and can do anything they want with it. If they don't use it for a qualified reason, they will pay the 10% penalty on top of ordinary income tax. But I think until they clarify this and hopefully put some more restrictions on it, like the House did, where you couldn't use it for anything but a qualified purpose until age 30, I think there are going to be a lot of people reluctant to create this pot of money that all of a sudden an 18-year-old is going to have access to, and the parent's going to have no ability to dictate how it's spent. Now, there is another component, the employer contribution program. Again, this isn't totally clear. So it talks about employers being able to contribute up to $2,500 per child, which does count towards that annual $5,000 limit. And that limit will be indexed for inflation beginning in 27. But it's not clear if that $2,500 is an annual contribution that can come from the employer or one time. They could have made it clear. They could have indicated one way or the other, but the way it's written, we have no idea at this point. So we'll be waiting for some clarification on that as well from the IRS. Now, there's going to be a requirement as the employer that you have a separate written plan for this program. What does that mean? No idea. What you see in quotes there is all that was provided. So again, we'll have to wait for guidance on what has to be in the written plan and what the requirements are going to be. and really how the program has to be operated. Employer contributions are going to be excluded from the employee gross income and not subject to federal income or payroll taxes. But they also threw in the line here that it is going to be subject to non-discrimination rule, similar to DCAPs that Molly was talking about. You cannot disproportionately benefit highly comps. Now, they used the word similar to DCAPs when talking about the non-discrimination rules. So again, we're going to have to wait and see if they're going to change with the average benefit test, for instance, or if they're going to keep it the same as what the DCAP rules provide. So until we get that, no idea. Now, whether this is going to make sense for you to offer to your employees is also going to require that you take into account some of the logistical things from day to day. So for instance, how do you get the money out of your account into theirs? So are they going to set up a separate account at a bank or financial institution? It's not going to be something you can roll into their checking account. You probably have direct deposit where that happens. So now you'd have all these other accounts you'd have to send money to. Is this going to be an ongoing program where you can put $2,500 in every year? If it's a one-time program, would it make more sense to just cut them a check, et cetera? So there'll be a lot of the day-to-day stuff that is going to have to be taken into consideration when you determine whether you want to offer this type of program. And not the least of which is it going to be the $2,500 of your money as the employer, or do you make a pool of money available to the participants and they can decide how they want to use that within the benefit program? That can have an impact as well. And again, no discussion about that at all in the legislation. Now, from a strictly investment point of view, as far as increasing or building a pot of money that could be used for a child when they get to the age where they would potentially go to college, the 529 plan probably looks like a better alternative at this point. Now, I will say anyone who has a child born in 25, 6, 7, or 8 should definitely open the account and take the $1,000. But the question becomes, do you want to put additional money into that account, or is a 529 plan a better option? Well, I will say the 529 plan has higher contribution limits depending on what state you live in. Some states go up to 10,000, others 15, some are unlimited. In addition, the parent retains some control over that money, so the children can use it for qualified education expenses. And if it doesn't all get used, there is some ability to get that back. You can either roll it to an IRA for the child, or the parents can get it back and pay tax. So I think that the fact you have a little bit more control inside a 529 plan is probably going to be more appealing to most people than the way these accounts have been set up. But again, until we have all the clarifications from the government, you really won't be able to make that determination. So I will hand it back to Sharon to talk about what was tossed out.
Yes, thank you. So what got tossed out? Bicycle commuting reimbursement. Under the prior law, employers could reimburse employees for bicycle commuting expenses, such as bike maintenance or storage or certain gear. And they could do that on a tax-free basis up to an annual limit. And this was part of a broader qualified transportation fringe benefit that's excluded from employees' gross income. The Tax Act permanently repeals this provision. It had been sort of repealed, but now it's permanently repealed. And the takeaway is that employers can still offer the commuting support, but now it would be treated as taxable compensation. And this repeal takes effect January 1 of 26. So what do we consider to be carry-on items? We've got a couple things here. Originally introduced in 2017, the PFML tax credit was set to expire at the end of this year in 2025, and the Tax Act makes it a permanent credit. It makes a credit permanent. It expands eligibility in several ways. The tax credit was designed to support employers who offer paid leave to employees, but the amount of the credit depends on how much the employee earns. So the employer gets a higher credit percentage when they provide paid leave to lower paid workers, and this makes it a really valuable credit to certain industries like retail and hospitality and healthcare. The law also expands eligibility to include PFML insurance premiums, and there are several other changes that were made in there. The changes may make it more attractive for employers to offer paid leave, especially as part of a broader total reward strategy, and the tax credit itself could help offset the cost of providing leave and support for workforce retention. This is one to talk to your tax advisors about. The next one is moving expenses. The temporary exclusion for employer-paid moving expenses has also been permanently repealed, except for certain members of armed forces and the intelligence community. Starting in 2026, the value of those moving expenses must be included in employees' taxable income. We would recommend that employers ensure that these amounts are properly reported on the Form W-2, and it is important at this point to consult with payroll providers and legal counsel to update any policies and systems accordingly. And Sarah, I think I'm ready. Yeah. Who missed the flight?
What got dropped? Yeah. So there was a lot of reporting on earlier versions of the bill, including from us, that had some proposed employee benefit changes that ultimately didn't make it in. And so we want to take just a minute to review these to clarify what didn't change. So first, while in the end we did get some notable changes related to HSA eligibility that Molly and Sharon talked about, on telehealth coverage, on HSA-compatible individual coverage, on those direct primary care service arrangements. There were a few proposals early on related to the flexibility of HSA rules that we didn't get. So including an increase in annual contribution caps beyond inflation indexing, allowing rollovers of unused FSA or HRA funds into an HSA when switching to an HDHP, treating fitness costs or gym memberships as qualified medical expenses that could be reimbursed from an HSA, and then allowing an individual to be HSA eligible even if they had currently and continuingly disqualifying coverage, like if their spouse has a general purpose FSA, if they're enrolled in Medicare Part A, or if they're using on-site medical clinic services. Then there were also some proposals related to individual coverage HRAs or ICRAs that were ultimately dropped from the final bill. The House version had rebranded ICRAs as choice arrangements, so you may have heard of those. And they proposed allowing small employers more flexibility in who they could offer an ICRA to, along with a tax credit for small employers. The law currently restricts employers to only offer ICRAs to all employees in certain classes. So like all employees who are part-time versus all employees who are full-time. Not a choice among those people in that class between an ICRA and a traditional medical plan. So that would have changed. The House version also proposed allowing employees to pay premiums for individual coverage on a pre-tax basis. So these ICRA provisions never came to pass, as well as those HSA proposals listed there as well. But I do think that we can keep these proposals in mind as employee benefit changes with some congressional support, perhaps see similar changes with other near future legislation, along with efforts to improve increased transparency in prescription drug pricing through PBMs, which was also in the initial version of the House bill, but got dropped during the reconciliation process. So that brings us to questions. I know we have 1 minute left and we got a lot of questions through the Q&A. And hopefully we answered all of those questions. I know one question we often get is, will the slides and recording be distributed? The answer to that one is yes, they'll be distributed at some point next week to everyone who registered. And now we're at the end of our time, so I want to thank the panelists for joining today and for all of you.
All right. Well, thank you to our speakers for sharing your valuable time and expertise with us today. To reiterate, today's presentation was recorded. We'll be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you'll receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At the end of this call, a survey will populate in a new window. Please take a brief moment to complete the survey, as it lets us know what topics are important to our listeners and helps make our education program as current and relevant as possible. That concludes our webinar for today. Thank you everyone for joining us, and have a great day.